WA has recorded 8,499 COVID cases and 5 S overnight, as the state continues to track well below predicted hospitalizations. Premier Mark McGowan said 4 of the S were historic and only reported to the Health Department on Tuesday. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. There are now 259 people in hospital with the virus, including 9 in intensive care. Wednesday's ICU rate sat at around 5% of the number originally expected thanks to WA's high vaccination rate. Of the 46,697 active infections in WA, 37,514 are in the Perth and Peel regions, and 2,246 are in the southwest. The Kimberley has 1,707 cases, and the Midwest has 919. The caseload rose from 8,145 in the previous recording period and is again nearing the expected 10,000 daily peak. It is not known whether WA has already reached its peak or whether cases will again rise. New data from the Health Department expected there to have between 1,175 and 1,877 cumulative cases in hospital by March 27, but there were just 451. During that same period, it was predicted between 60 and 108 people would be in ICU, but there were only 22. In the week ending on April 3rd, modeling expected between 120 and 206 ICU cases, but the cumulative number had risen to just 25. 1 in 3 people hospitalized are not vaccinated against COVID-19. And 66% of people have not received more than 2 doses. The data, released on Tuesday, also showed that the most likely group to end up in hospital were those in their 50s. They accounted for 17% of hospitalizations between March 21 and April 3. Children under 10 and people in their 20s were just as likely to end up in hospital as people in their 60s. The Health Department has begun advertising a winter booster COVID vaccine for those in high-risk groups. It takes the number of available COVID jabs in the state up to 4.